Good evening, sir.
Hello.
Good evening, sir.
Ah,
So we shall start now.
hello.
Shall we start now, sir?
ഇതിൽ ഒരുപാട് പാർട്ടിസിപ്പൻസ് കാണുന്നുണ്ട്.
45.
ഇവരൊക്കെ അപ്പൊ എന്ത് അപ്ലൈ ചെയ്തവരാണ്?
They have all registered, sir, for the allied. And many of them would have been for anesthesia technology also.
ദിസ് ഇസ് കോമൺ. ലാസ്റ്റ് ഇയർ ഒക്കെ നമുക്ക് അനസ്തീഷ്യക്ക് മാത്രമായിട്ടാണ് ഇതിൽ അതുകൊണ്ട് ചോദിച്ചത്.
This is a common entrance test, sir. So now like they are all registrants who will have applied for AHS.
ശരി. അപ്പൊ വാട്ട് ഈസ് മൈ റോൾ നൗ?
Sir, I would like you to like tell them like what is the importance of this particular course, the scope of it, the job opportunities, and why like Amrita, they should choose Amrita for the same.
അപ്പൊ how much time?
Like
10 minutes?
15 minutes or so.
Sure. Okay.
Okay, doctor. Like, let me start then. Let me
Yeah.
introduce you first. Okay. Hello and a warm good evening to one and all. I'm your host and moderator, Preeta Harikrishnan, Deputy Manager Admissions, Amrita Health Sciences, Kochi Campus. Thank you all for joining us today as we deliver to you a talk on anesthesia technology. This topic will surely enlighten you on the benefits of the program, and to make sure we are helping you the best, we have the chat box to send your doubts. The doubts will be clear towards the end of the session. So let me now introduce to you our special guest, the most dedicated and energetic Dr. Shyam Sundar sir. Doctor is presently working as additional professor in the Department of Anesthesiology at Amrita Institute of Medical Sciences. He completed MBBS and DA from Coimbatore Medical College, Chennai, and DNB from Amrita Institute of Medical Sciences. His vast experience has brought him glories like the Fellow of College of Critical Care Medicine and the European Diploma in Intensive Care by European Society of Intensive Care Medicine in 2014. I welcome you, sir, to address our attendees who are anxiously waiting to hear from you about the anesthesia technology course, its scope and job opportunities, and why they should choose Amrita for the same. Welcome, sir.
Oh, thank you for that your nice intro. Warm welcome to all the participants here who are eager to join various allied health sciences. And today I'm here to tell you something about anesthesia technology. Some of you might know what anesthesia technology is, some might not know. I'll just try to enlighten over the next couple of few minutes. So anesthesia technology is a specialty where your primary work area would be, as you can understand from the title itself, will be where anesthesia is provided. So earlier it used to be only in the operating rooms. Now anesthesia is sometimes provided beyond the operating rooms, what we call as outside anesthesia, like cath lab, endoscopy suits, radio, MRI suits, PET scanning, and all those areas. But still the predominant work would be confined within the operating rooms. For various type of surgeries, anesthesia is required. So the anesthesiologist who's qualified after his MBBS and MD, and also nowadays they specialize further in cardiac anesthesia, neuroanesthesia, transplant anesthesia, and etc. So such qualified anesthesiologists would be providing anesthesia for various surgical and non-surgical procedures outside the operating room. So the job.
Sir, you're muted.
Oops. So do I begin from all over again?
Pardon? We can hear you now, sir.
Okay. So I was muted all the while.
No, just now.
Okay. Yeah. So your primary job or work designation would be to assist the anesthesiologist in the providing anesthesia for various surgeries and other procedures. So anesthesia requires, for delivery of anesthesia, we require a lot of equipment, like the anesthesia workstation. Various gadgets are also needed apart from the anesthesia workstation. So you will be trained to handle all these gadgets, and you will help the anesthesiologist, while each of those gadgets are required to be used. And anesthesia being a specialty where the risk element is pretty high, all the things that the anesthesiologist needs to perform, sometimes at least will be, there will not be a predetermined time to prepare for such a thing. So the anesthesia technologist will have to be on his or her toes most of the time. But generally, when we have an elective surgery, as we call it, surgery that is planned to take place in a few days from now, and so we have the proper, the list coming to us, we might have the time to prepare for such a scenario most often. But then we also have various emergency procedures which would come up all of a sudden. So we'll need to be prepared to provide anesthesia even during those emergency situations. So it's important that the anesthesia technologist is aware of the the nature of the procedure, whether it's elective or emergency, and be prepared in such a way. So that's why we offer an extensive training, where the training program would not just be of theoretical in nature, like you have, because it's called as a BSc, you might think that it's a bachelor's degree, like in any other college, where you might be sitting in the classroom and listening to lectures from morning till evening for the next 3 to 4 years. But that's not how allied health sciences courses run, for that matter, and definitely not anesthesia. So in the first year of your curriculum, so BSc by now you would know is that we run in Amrita Institute. It's a 4-year program. So in the first year, you are introduced to the various various subjects, basic science subjects of the medical curriculum, like anatomy, physiology, and the likes. So for 1 year, it will be more of a classroom kind of a teaching. But from second year onwards, you will be exclusively working or practicing and getting trained, including having classes in your designated area. So for anesthesia technology, it will be in the OR, in the Department of Anesthesia within our institute. So most of the time, it is from the second year and third year, it will be of a practical training. Theory classes would happen, but you will be trained to handle things. So in the second year of your degree, you will be allowed to observe the aesthetic when it's being delivered, what an anesthesiologist does, what the qualified anesthesia technologists do there, how do they go about assisting, what are the various gadgets, how to handle all those gadgets. All these things you will get to see, sort of observe. And in the third year, you will get some sort of hands-on, basic training. You will start doing that as well. And by the fourth year, once you complete and qualify with the final exam, each year you do have university exams. So once you complete all the 3 university exams for all the 3 years and you pass your exam, only then do you get to do the internship. And during your internship, you will be having a lot of hands-on training. And during that period, you will also be, posted in the various areas that I mentioned at various time frames, like the morning hours, the evening hours, sometimes the night hours and holiday time, because that's how the specialty runs. And that's exactly the sort of training that you're going to receive over the 3-year period. So especially during the internship, you will get to do, all sorts of things that a proper anesthesia technologist does. So when you enroll for a BSc program like that which we have here at Amrita, you get an extensive sort of a training, to be a properly qualified anesthesia technologist. You not just get the theory, learn the theory part of it, but you also get a very sound, practical, hands-on experience. And so that when you complete the 4-year program, including the 1-year internship, you will be well qualified, well trained, and job ready, if I could put it that way, and you would be able to practice anywhere that you join, either here or outside the state or any advanced institutes or even abroad. That's all. You would be well qualified to go and work anywhere. And as part of the training, like I mentioned, you will be exposed to the operating room environment. So there are certain things that you need to know about the operating room. One, it is going to be a tightly temperature and humidity controlled environment because the operations can only happen at a specified degree of temperature. So it's an air conditioned environment all throughout, and that's where you're going to be throughout your second and third years, and as well as the internship. So some candidates sometimes find it a little difficult to work in that sort of a temperature. Usually it's to the degree of 18 degrees Celsius. So, and some people, very, very rarely, that doesn't usually happen, have found some difficulties to that sort of an environment. So you need to make sure that you do not have such issues working in that sort of a temperature. The other thing is when you work in an anesthesia side in the OR, and especially in the non-operating rooms like the cath lab and the radiology lab and etc., there is some risk of exposure to radiation. If you had been to any hospital previously, you'd know that the radiology suits, there would be a signboard saying radiation hazard. So that sort of a thing happens sometimes in the OR and sometimes in the labs, like which I mentioned. But we are provided with protective gear to protect ourselves adequately. So what I mean to say is that even if there is a risk of radiation risk, we would not be in a position to leave those areas because we have anesthetized the patient. The patient is there, and we are going to be there till the patient comes out of that particular anesthetic. So that sort of a radiation risk also exists. But we do have all the necessary, protective gear for that. This radiation risk would be slightly less than that, from what a radiology technologist or a cath lab technologist would be exposed to, because their entire period they're going to be in that sort of a situation. But for anesthesia technologists, it's only going to be from time to time with the provided protective gear. It would be safe to work in such sort of a thing. The other risk that is involved while providing anesthetic is that we do handle needles quite a bit. So any needle stick injury, if we accidentally injure ourselves with the needle that has been used to poke the patient, we do run the risk of getting the infection if sometimes the patient has a blood-borne infection, like say hepatitis B and C. So that sort of risk is also there. So you would be trained to handle all these things the proper way so that you take your own care very well and you do not injure yourself. But ultimately, on the end of the day, our safety is our own responsibility. But you will be trained to, take care of yourself over the 3 to 4 years that you're going to be here. So those are some of the things that you need to know when you have to get trained in such an environment. Coming to the course proper, like I mentioned, the first year is going to be of basic sciences, which will be taught to all the allied health science different specialties together in the medical college. And at the end of the first year, you will have a set of exams. And once you clear that, you do enter into the second year. And and from then on, all the specialties are segregated. So the anesthesia technology students will only be in the anesthesia department with hardly any interaction with the other students. And your curriculum will be it will be specially tailored for the anesthesia technology students. So there could be quite a bit of dissimilarities with when you try to see what the other specialties do. So comparison was not going to help us because each specialty is unique, and the candidates are trained to, in those specialties would also the training modalities and training methods and training duration and pattern is all going to be different from one specialty to the other. So when you enter in the second year as anesthesia technology students, you're going to be in the one. Like I said, you'll get trained. You'll get to observe quite a bit during the second year, all the procedures and what all is done. And along with it, from a periodic manner, you will have your theory classes. At the end of a specified period, you will have internal assessment exams. It's mandatory that you score a particular percentage of marks in your internal assessment exams to be necessary to qualify to sit for the university exam at the end of the year. And attendance is also mandatory. I need not emphasize on that. So once you have the prerequisite attendance as well as the internal marks, which should be held, internal assessment exams would be held in periodic intervals. Maybe you'll have 2 or 3 in a year, and then you qualify in those, you will be able to sit for the university exam at the end of the year. So second year is going to be more of observation, but when you come to the third year, which is the final year of your theoretical training, you will be getting some hands-on training, as well as your theory classes would also continue side by side, and you will still continue to have the same sort of internal assessment exams. And if you qualify with the minimum marks that is required in the internal assessment exams, and you have the requisite attendance, you would be eligible to sit for the final university exam. And only if you clear the exams, that is, you will have a theory, you will have a practicals, and you will have a viva. And this viva exam and practical exam, you are going to have external examiners as well. So it's not necessarily the examiners from within the institute. You will have at least 1 or 2 external examiners coming over to assess the training that you have gained over the last 3 years. So once you have through with this, then you qualify to take up the internship, which will be a 365-day program with some allotted leaves only. So since this is a pure training program, that is the internship, the amount of leaves that you're going to take will end up as extension. So each candidate will be finishing their internship the time that they have completed 365 days. So if somebody goes on a leave for whatever reason, say for a period of time, that will be end up as having that to do as extension. So all the candidates will not be completing at the same time. So once you finish the 365-day internship program, you will then qualify to get the degree certificate from the university. And that's how your training is going to end. Regarding regarding job prospects, once you qualify, you do get to work as an anesthesia technician or technologist in various institutes within and the country, within the state and outside the state. And sometimes people tend to go abroad, but whenever they go abroad, especially the Middle East or the Southeast, Singapore, Malaysia, UAE, Saudi, and all those places, that's where the bulk of the candidates seem to go. They need to have a minimum of 2 to 3 years of experience, because that's how they ask for it. So once you have their experience, you tend to go out, and then the pay package is going to be significantly different from what you get in the country as opposed to what you get abroad. So one way of looking at this, since you are job ready, you can start working immediately, and then you can, with necessary experience, you can even look for jobs outside, which is what mainly many people tend to do. The other thing is about whether we can go for European countries like UK and other European countries, or maybe the Australian and US sort of places. What I've understood is our anesthesia training program, that is, which you obtain anywhere from India, you will not be eligible to work with that sort of training. So if you go to Australia, New Zealand, or sometimes to Canada, you need to get their training as well before you can start working. But of late, United Kingdom has started, taking anesthesia technologists for work. There they are called as operating room personnel. So, but anesthesia technologists do qualify, but you need to do a specific registration with the licensing authority in UK, and then you do tend to get job in the UK. This is a current scenario. It could change. It could no longer be there a few years down the line, or it could be changed to a different pattern later on. But currently, country where you can work with an Indian qualification seems to be the United Kingdom. Any other Western country, you will need to get trained again, that specialty there, and only then can you work there. Coming to post-graduation, that could be one of the things that you might think about. As far as I know, there is no master's program, master's degree in anesthesia technology within our state, that is Kerala. But outside Kerala, I do know that a couple of states, at least in the south, that is Karnataka and Tamil Nadu, do offer MSc programs. But I'm not sure what this additional post-graduation can offer to an anesthesia technologist in the form of giving an added, exposure and training from a work perspective, because most of the things that you almost all the things that you need to know to work as an anesthesia technologist, you do gain that sort of a training during the bachelor's program itself, especially the one that we have here. So though there are a couple of programs, master's programs outside our state, I'm not sure how, that is going to be of much help. One thing which I do understand is such candidates then try to secure a teaching job in some institutes where they do get to teach, the BSc students in anesthesia technology. But then I'm not sure if that sort of a thing is available within the state. Maybe it is available where these master's programs are there, that is the neighboring states. Can we do masters abroad? That would be another question. But as far as I know, there is no master's program in anesthesia technology, even in the UK, but or Canada for that matter. So what people tend to do is they do go there and they end up doing some other allied health master's program, like in public health and or research and things like that. And then they continue to pursue a career in that direction, not necessarily as an anesthesia technologist. So this would be, when it comes to postgrad, this is what I can tell you now. This is the current scenario, but it could change. So as of now, coming back to our course, that is what we have here in Amrita Institute. It's probably the only institute offering BSc program in the state currently, but you do have a lot of bachelor's program in Tamil Nadu and Karnataka and all. Otherwise, most places do offer only a diploma course. Ours being a bachelor's course, you will have a 4-year program. And like I said, this institute, Amrita University, has got its reputation of its own. So if you get trained in our institute, this will be very, this will add to your curriculum vitae, and then you would get better jobs when you go abroad or even to other states. So that will be a definite added advantage. But more than what is there on paper, what I would like to highlight here is that we have almost 30 plus operating rooms with 10 or less candidates being taken per year. So even if you see over the 3 years, we have 30 candidates only, excluding the first year because you are not coming to the ORs that time. We still have 1 OR per candidate. So the amount of exposure that you gain is immense. Whereas many other institutes, many other institutes, almost most of the institutes that I know of, there are 5 or 6 operating rooms, or at the best 8 to 10 operating rooms, and their annual intake is 10 to 12, sometimes 15 candidates they take. So over a 3-year period, they would have 40, 45 candidates, and the number of ORs they have is 10. So that itself goes to tell you the amount of exposure that you might gain elsewhere, the amount of exposure that you would get here. And the difference is going to be immense. And we have seen this many times, because sometimes when we employ candidates who are trained elsewhere, candidates who have done BSc programs from other states, the kind of exposure and the training that they receive is of substandard quality. And I can very well, confirm this, because I'm also part of recruiting candidates for anesthesia technologies for the work, and I do oversee their program as well. So the difference is quite palpable, and therein lies the importance of doing this program at Amrita comes in very handy to you. You do get a lot of hands-on exposure. You are job ready, and the qualification holds good wherever you go. So with that, I would like to conclude my, program. Thank you all.
Thank you, doctor, for that valuable information that you have given. There is one question. If I pick this course, does this narrow down my course options when I move on to PG? If not, what courses related to this will I be able to study in PG?
See, as far as I know, there aren't any PG programs. So I have not read the UGC guidelines, but from what I understand, the UGC guidelines specifies that if you want to do a master's program, you should have done a bachelor's in the corresponding, specialty itself. Only then will it be valid. But then candidates do tend to do some master's program here itself, like they do Master of Hospital Administration, MHA kind of program. They do go ahead and do that. So for that, any sort of BSc Allied Health Science program, they will qualify to do hospital administration. I'm not sure about public health, Master of Public Health here within our country, but I have seen them doing MHA. That's one thing that they do. But for that, you can do any thing. So if you do a dialysis technology, cath lab technology, anesthesia technology, the masters you should be doing in the corresponding field. Otherwise, it's not going to be of much use unless you want to do hospital administration, which is a totally different thing. It's got nothing to do with anesthesia technology as such. So okay. I wouldn't say by taking anesthesia, you are going to narrow down, because whatever you take, it's better that you do in that same thing. The only thing about anesthesia technology is that there's no master's program in anesthesia technology within our state, but there are master's program for other technological fields. Like I think there are master's program for dialysis technology or cath lab. I mean, they'll need to look up. But as far as I know, anesthesia technology doesn't have a master's program in Kerala yet. Could come up in future, but right now we don't have. I can't hear you.
What is the entry level salary expected in India as an anesthesia technician?
Oh, it's very, very varied. It's very, very varied. So whatever number I say, you might get, directed towards that number. It's better to inquire on your own. Because it's very, very different. See, if you have a program run where there are 10 theaters and 45 candidates come out of that, what of salary you're going to get, isn't it? So that's why we keep our numbers at a smaller level so that you can get a better pay. But I think it will be based on the labor guidelines as well, if I'm correct, from state to state. So any minimum salary that is fixed by the Labor Commission, I think would be given by the institutes because they need to comply with that.
Okay. Janvi, do you have any question? Janvi? I think she raised her hands. Janvi? Okay. Doctor, the best of students who have taken this course in Amrita, do they have a chance in our hospital?
Yeah, of course, they do get a chance. And whenever there is a vacancy coming up, we prefer our own candidates because we have seen the difference. So if we have one vacancy and then we have one of our candidates, we would most certainly go for that same candidate. Or we take other candidates only when we do not have a candidates. But then if we do not have a vacancy, when they complete, we will not be in a position to take them up. But if they still want to work with us, we can keep them waitlisted, and as and when a vacancy comes up, we would absorb them. But it's not mandatory. It's not guaranteed. Only if there is a vacancy will they get to be absorbed.
Okay, that's nice to hear, doctor. There is another question. So working abroad requires a separate training program. If so, how long might it be?
Oh, I have no idea. I mean, it will depend on the country that you're going to, Australia, Canada. So you'll need to look into that.
Okay, based on those countries, what they say.
Yeah,
I think that is, yeah. Okay, any other doubts? Doctor, so happy that
I mean, I could think of a minimum of 2 to 3 years of training might be required wherever they go. Okay. I don't think it will be anything less than 2 to 3 years.
Okay. So as such, like after the BSc Anesthesia Technician course, they are eligible, highly eligible for jobs, even though they don't like, we don't have PG course over here, but still, if they want to go in for a teaching profession, then
That is the only role that I think they might qualify additionally with a master's degree, because if the institutes want to employ, we currently we haven't employed any anesthesia technology master's program holder to teach our BSc students here. All the teaching is done by anesthesia doctors themselves. But in
okay,
many other institutes outside the state, especially, they do have lecturers sort of post, and for that you will need to have a master's degree. So currently, this is what I can see as an added a role that the MSc candidates might get. But otherwise, if they want to work as an anesthesia technology, nothing prevents them, even with a master's. But whether they will have an added advantage of having an MSc degree when they go for a pure anesthesia technology job, that's what I meant. I'm not sure. Because
okay,
here, at least, we do not look at people with MSc degrees when we employ them. For us, BSc is quite good enough. Anyone with BSc is quite good enough.
okay. So, Doctor, I don't see any other questions over there right now. So I'm so thankful that you spent your time with us. We had a lot of attendees. I hope you have really got good information about anesthesia technology from Dr. Sham, who has a lot of experience and who has given you such a lot of information, and which is really helpful. And we expect to see you soon at Amrita, the entrance exam, which will be held in May 18th and 19th. Before we wind up, we have Aishwarya from the admission office who will just tell you about the admission process this year. Aishwarya. Doctor, we have an admission process which she would explain to us.
Can I leave, or do I need to stay for it?
It's okay, doctor. You can leave, because if there is any other, we could drop it. Thank you, doctor, so much once again for spending your time with us. Thank you.
Thank you, ma'am. Am I audible?
Yes, yes.
Good evening on and all. I am Aishwarya KS from Admission Office, Amrita Institute of Medical Science, Kochi campus. So I am here to explain you about the admission procedures for the course BSc Anesthesia Technology for the academic year 2024-25. So I will just share you the screen. So the duration of the course is 3 years plus 1 year internship. And the eligibility is the candidate should be minimum 17 years of age and maximum 23 years of age as on December 31st of each admission year. The candidate should secure 60% aggregate marks in physics, chemistry, biology, and English. The selection will be based on the rank obtained in the Amrita Entrance Examination Life Sciences, that is AEEL. Counseling will be after the allotment of seats. When coming to the AEL, it's a computerized online exam. The examination centers will be allotted to the candidates. The duration of the examination is 2 hours with 80 questions and out of 240 marks. The syllabus is based on +1 and +2 physics, chemistry, biology, and English. The candidate will score 3 marks for every correct answer and -1 for each incorrect answer. When moving to the fee structure, the tuition fee for scholarship category is rupees 1,80,000 per year, and for non-scholarship category, the tuition fee is rupees 2,60,000, and for NRI, it is 4,500 USD per year. Other fees is rupees 38,450 per year, and the hostel and mess fee is rupees 68,000 per year. The other fee and hostel fee are common for all the categories. When coming to the registration, you can register through both the portal, AOP portal, and through our website. The AOP portal link is applyug.amrita.edu, And our website is amrita.edu/admissions. And we have an online registration fee of rupees 550. And once you are done with your payment, the registration is completed. All the updates will be available through your registered email and Amrita website. And the last date of registration for the examination is 13th of May 2024. And we have 6 steps for online registration. The first one is register with your email. Second one is you have to fill your personal informations. Third step is application. You can select your course there. And fourth one is payment. You can do online payment. And the fifth step is you can fill your academic details. Sixth is document uploads. You can upload the documents, whatever you have. And if you didn't get your 12th documents, you can upload it later. And our examination date is May 18th and 19th. We have 3 slots. You can write your exams in any of the days. And we have 3 slots. Slot 1 is 9 a.m. to 11 a.m. Slot 2 is 12 p.m. to 2 p.m. And slot 3 is 3 p.m. to 5 p.m. The candidates can choose any one of the day and any one of the time slot for the entrance exam. And for all enquiries, you can mail us at ugadmissions@aims.amrita.edu or contact the following numbers. This is the contact numbers that is given in our website, amrita.edu/admissions. And please note that Amrita Vishwavidyapeetham has not appointed any agent or third-party client for securing admission in any program. Students are hereby requested to contact only the toll-free number on our website for any admission-related queries. Thank you. Over to you, ma'am.
Thank you, Aishwarya. I think it is clear to all the attendees now, like how the process is. And if you have not yet registered, there is time up to May 13th. So by May 13th, you could register yourself, and then we have the exam on May 18 or 19. Any one of the days you could attend the exam. So once again, wishing you all the best. I think we could wind up for now, as we have no more doubts. All the doubts cleared by doctor and also by our admission staff. So I think we could wind up now. Thank you once again, all the attendees who have been here this evening with us. And once again, wish you all the best. Thank you.